One of the most common questions I'm asked is, will I need to be on preventative therapy for the rest of my life, such as Propecia and or laser or Rogaine? And the answer is yes. However, what those preventative therapies are most likely going to change. There's a tremendous amount of research being done in the hair loss field. I'm actively involved with this research, both through my work at the University of Miami, as well as through other research that we're doing here in the practice. And what we're working on is so many different techniques. Some others are working on hair cloning, maybe 3D printing of hair follicles. We're working on, so that's more of the cloning of hairs or the cells of hairs that can then be injected. But we're also working on preventative therapies. Currently, we're conducting a study comparing PRP or platelet-rich plasma with fat transfer. It's a technique that we've developed where we take an individual's fat, it's harvested, small amount of liposuction, no more than 15 or 20 cc's, sometimes as much as 40 cc's of fat, done under local anesthesia. The fat is then filtered, combined with PRP, and then injected into areas of thinning. This is a treatment not only for potentially androgenic or male or female pattern hair loss, but also for areas of scarring alopecia, such as when there's been a burn, but also in cases experimentally we're determining whether it's effective for things like frontal fibrosing alopecia and lichen planopilaris. But there's another example. There's also exosomes, which are therapy that are designed to basically provide these vesicles where they can release these indicators that turn on hair growth. So there's so many areas of research that are being done within the hair transplant field or the hair loss field that most likely in the next, I'm going to say by 2024, 2026, we'll have some more effective medical therapies and maybe even sooner. But for now, we have to think of hair loss as a chronic process, and we need to control that process by giving the best medical therapy possible to help an individual maintain his or her existing hairs for as long as possible, assuming that that is the patient's goal.